So the health challenges of shanty towns like Ajegunle or Makoko could be physical, mental, or social health challenges. Physical challenges include illnesses like gastrointestinal diseases like dysentery, cholera, for example, because of poor supply of clean water. Other physical challenges include tuberculosis from overcrowding, for example, air pollution as well, both indoor and outdoor, can lead to also respiratory diseases. In addition, mental health challenges abound in those locations, like depression, anxiety, because of the poor living conditions as well as the unstable living conditions. Social health challenges include social exclusion, for example, also vices like exposure to drug abuse, exposure to prostitution, for example, school dropouts. These are all social health challenges. But how can we manage these challenges? These challenges should be managed at the national, sub-national, community, and at the individual level. At the national level, the country has to invest in human development, education, up to secondary school education should be provided for individuals with as little investment of funds as possible, possibly free where that is possible. Also, health services should be available to every single individual through primary health care. Primary health care is the most basic level of healthcare that a community or a country can receive, addressing the major health problems of that community in a way that is culturally acceptable to that community. Investment in the health system is extremely important. Also, national health insurance should be made available and accessible to as many individuals, whether they're the informal or formal sector. Other things that we can do at the community level is to have situations where communities can actually come together to provide assistance for their communities in terms of education, because we know that as people are better educated, they're better able to earn higher sources of living and are able to take themselves out of the areas where there are poor living conditions, like Makoko and Ajegunle. And also, another solution is investment in rural development. When we invest in rural development, individuals are not so eager to move to urban cities, leading to rapid and unplanned urbanization and leading to such slums and shanty towns like Ajegunle and Makoko. So developing other cities outside of the big cities will go a long way to reducing overcrowding and overpopulation in the big cities, resulting in such shanty towns like Makoko and Ajegunle.